Happy Sunday. This is Dr. Janelle O.D., your eye care expert. We're here for our 10th episode of Eye Spa Talk, Tales from the Trenches. Today we're going to be talking about AB Max. We're going to talk about lid microexfoliation. So before we get started, I'm going to introduce myself. For those of you who do not know who I am, my name is Dr. Janelle Davidson. I'm your eye care expert. I'm the CEO and founder of Great Eyes Vision Center and Premier Eye Spa, located in Smyrna, Georgia, at the Shops at Belmont. I've been practicing optometry for 14 years, and I've been a private practice owner for 10 years. What makes my office special is that we have a unique eye spa. So eye care is self-care. We teach you how to identify ocular surface diseases that could potentially lead to dry eye, meibomian gland dysfunction, and a host of other diseases in the front part of the eye that will make your eyes uncomfortable. In addition to that, we offer self-care services like lash extensions, organic facials, anti-aging, anti-acne, you name it, we offer it with a licensed esthetician because we want you to not only see clearly but feel your best. So today we're located here in my eye spa. We're going to talk about lid microexfoliation, and then we're going to actually have a live demonstration. So if you guys were here the Sunday before last, because we do our episodes the first through third Sundays, I was doing a dry eye evaluation on my husband. And so now we're going to actually clean up those eyelids. And yes, we'll talk more, but you can clean up eyelids on everybody, including men. So let's talk about eyelid microexfoliation. And what does that mean? So it means that we're cleaning up the lid margin. On the lid margin, there's a zone where your lashes come out of the eyelid, and there's a natural bacterial zone there. And that zone has a natural bacteria that we call the biofilm. So the biofilm is like plaque. It's very similar to the nastiness and grittiness that you may feel in your mouth, especially in the morning. So that's why we always brush our teeth when we first get up in the morning and at night. So we're minimizing the level of biofilm or bacteria in our mouth. Our eyes are one of the places that we don't clean regularly, or we don't clean properly. So a lot of men just don't clean that area, period, if they're not into wearing makeup. And then women wear makeup, but we don't necessarily clean that area properly, okay? So before we get going and go further, I want you to share. Sharing is caring. So there is a like and a share button at the bottom left-hand corner of your Facebook app. So go ahead and hit that button so that way everybody else gets this information. And I'll try to pay attention on my laptop so that way I can see if I can ask and answer any questions. So feel free to put questions that you may have in the comment box. So we have a cool diagram that we're going to pull out here. So this looks gross, right? So this is a mite. This is a Demodex mite. Yes, this little mite can live on your eyelashes and eyelid. So Demodex, this mite has made a big appearance in our world in the last couple years, especially with the lash boom, all right? So you may see this mite and think there is no way that this can be, I dropped it, on my eye. Yes, it can, okay? And it's called a Demodex mite. We really know about mites when people wear lash extensions, especially if they're not cleaning their lids properly or don't take breaks. But I diagnose Demodex all day long, and it's not only in women who wear lashes. Some of the most cases that I diagnose with Demodex are men. And this procedure that I'm going to do on my husband, I've done countless times already on men, okay? But the Demodex mite can live on the lid margin, and if there's an overgrowth, it can start what we call collarettes or flaking along the lid margin. If those collarettes or flakes flake into the eye, it can cause a conjunctivitis, it can clog up your glands, it can exacerbate styes and chalazions. It's just nothing that you want there. And even though this might look so big now, it's just a schematic. A lot of times you can't even see this, right? So when you're going for your regular eye exams, that's one thing that we automatically screen for. Eye doctors are one of the few, or we're the only doctors that can have a special instrument that's called a slit lamp. So usually if you go to optometrists, ophthalmologists, they have a slit lamp. And we're screening for Demodex mites, excessive flaking, blepharitis. We're looking on the lid margin for those things because we have a high power magnification where we can look for those things. And if we see them, we're going to let you know. So sometimes patients come in for regular exams and they're not expecting to hear that they have that nasty thing living on their eyelid, and they're not necessarily symptomatic. That's perfect. We caught you at the right time. That person or that patient would be a great candidate for a lid microexfoliation. Who is also a great candidate? Anybody that wears contact lenses. So anytime that you're wearing contact lenses, you're always touching around your eye. Even if you're keeping your hands clean, constantly touching around around your eyes is going to potentially exacerbate overgrowth of bacteria that's supposed to be there. So if you've been wearing contact lenses for years, you're a great candidate for lid microexfoliation. If you wear makeup daily, so if you wear shadows, liners, mascara, you are someone who is a great candidate for a lid microexfoliation, because every day that you're putting those makeup on, liners, and shadows, you're cleaning them, but you're not really restoring the balance and getting all of that bacteria off of there. So if you wear makeup, of course, if you wear lash extensions, you should have this process done in between your fills, especially if you wear lash extensions regularly. There should be a time where you don't have them on and you're taking a break. That's a perfect time to have this lid microexfoliation. Our esthetician is certified to do it here as well, so she can do it in between your fills. And then there's some cases that your eyes may get irritated that you may actually have it done while you're wearing your lashes. So you can expect to have a little bit of lash loss, but there's a special mode in the particular device that I use that help minimize lash loss. So it's something that you can at least have done if you're having, let's say, an outbreak or overgrowth, and maybe you just put your lashes on and it wasn't caught by whoever was doing your lashes. Because if you're here, this is something that our esthetician is examining your eyes for, and she will not put lashes on you if this is seen. And then anybody who just wants the cleanliness feel of their lid and lash margin is equivalent to flossing your teeth. So you don't have to have any of these strenuous circumstances to want to have this lid microexfoliation. It just removes all debris, allergens. It just gives your lid margin that very clean feeling, just like if you just brushed your teeth. All right. So this is a Demodex mite. So that's one thing when we're cleaning those lid margins. This is the extreme case. We can get those off, right? We're going to go over a lid structure here, right? So this is the eyelid. So this eyelid here is a nasty eyelid. That eyelid is full of blepharitis, flakes, probably Demodex, and this is a normal clean lid margin. So this is what I pull out to kind of show patients what I'm seeing. And of course we take a picture so you can see your own eye, but this helps us break down the structures here. So you can see how the lash margin and the lid lashes come right out of the lid, and they're critical to a lot of structures in the eye, right? So if these lashes have an overgrowth of bacteria, then you're increasing your risk of that bacteria getting in and disrupting the normal structure of the glands, of the muscles, a host of things that help contribute to the comfort of your eyes, which is going to increase your chances of infections, ocular surface disease, and just a host of uncomfortable things. So this is a healthy eyelash, and this is how your eyelash should look no matter if you wear contact lenses, if you wear lash extensions, if you wear magnetic extensions. This is a clean, healthy lash. This is a lash that is ravished with blepharitis, debris, crust, and Demodex. And if this is seen, then you're someone who definitely needs to have a lid microexfoliation, okay? So we're going to prep the area here. So we're going to do an actual lid microexfoliation. So usually when you have this done, we first usually evaluate the lid margin. We'll take some images. So we'll have some before and after pictures of your lid margin. And then we usually have to come in, and there's two types of cleaning that you can get. The cleaning starts at $99, and it's on the highest end of $139. The $139 it's bundled, so it does come with all the aftercare things that you would need for the next 30 days so that you can continue the cleansing process at home. I've had some patients that say, you know what, I'm not gonna clean at home like I'm supposed to do it. I'm just not gonna do it. So is there a way I can come regularly? So we could come every 4 to 6 months, just like you would get your dental cleaning, to have your lid lash margin exfoliated and rejuvenated. So let me get my husband, because he's getting ready to be our person that's gonna get their lids cleaned today. All right, so let me grab him. Now he's a little nervous. He doesn't like being on camera. All right, so have a seat. And so we're gonna turn this here. So we have this nifty chair. And typically when this is done, the patient will have a mask on, but I'm already exposed to him all the time, so I don't think he's bringing me any corona. But I will put my mask on. The patient will have a mask on. We've already Lysoled the chair. And then I usually will have a shield on, or the certified lid hygienist will have a shield on. So we're going to bring your chair back, Jimmy, okay? So we're going to bring your chair back. So I'm going to lay him down so that it's easier for me to clean his lid. So let's go here. You're going to go all the way down. And then I'm going to raise him up. Okay, good. He's looking a little nervous. All right, so typically, when we clean the lids, I will put a drape just because some of the solution kind of pops a little bit, and you usually don't like to mess up your clothes. So we'll put a drape on here. So that way we won't get any of the cleansing agent on him. Now the cleansing agent that we're going to use is a foam. It's by Blefadex. It has tea tree oil in it and coconut oil. So that's going to be our cleansing agent of choice. After the procedure, you may have a little bit of redness of the eye. We'll usually give you a drop of Lumify in the office, and then you have a drop that you can take home. Some patients are put on an antibiotic drop after the procedure, but that really just depends on how intense the cleaning needs to be and how much Demodex or blepharitis was present. He's on a mild end. We're using him today as in for demonstration purposes. So typically we're going to do one eye. So we'll usually put a drop of Piperacane. This is a numbing drop. We put this in. We put the numbing drop in not because it hurts, but because just having somebody around your eye can be a little weird. So it helps you to be comfortable. Typically when you're in here, the lights are down. We have our mister and diffuser on. We'll have some smooth jazz playing. But that's typically what shows when you come in here. All right, so you can hold your head back here for me. Good. And I'm going to put a drop here. It's going to sting a little bit. Good. Just keep your eyes closed for me. All right, so this is the AB Max here. So if you're an optometrist and you're looking at this today, this AB Max lid microexfoliation is very similar to an alga brush. But what makes it different than some other devices that are on the market, that there are 3 modes. So once this is turned on, you have a forward mode and you go in a circular motion forward. You have a reverse mode. So you have a mode that's actually cleaning one way, cleaning the other way, and then the patented pulse mode. The pulse mode is really cool. The pulse mode actually gets in between each lash. So it's almost like flossing. So you're going to clean and then you're going to floss, okay? So you'll just follow each mode and then you'll move over to the other eye. And for this segment, we're just going to do one eye today, okay? So typically you take the top off here, and everything has already been sterilized prior, so we're just going to go ahead and take an alcohol swab and clean things down here. And then we have a sterile tip that we're going to put on, a sterile tip here. So you put the sterile tip on. And our cleansing foam of choice is Blefadex. This is the cleansing foam. The Blefadex has tea tree oil and coconut oil in it. And this is going to help to soften, break up, cleanse, and moisturize and refresh the lid margin, okay? So after I put just a little bit of foam in here. There is a spot on the holder of the device where you can put the foam in there. But I put it here just because I can easily dispose of this once it's over. But you're going to take the tip and you're going to hold it in here and get it nice and moist. Now, Jimmy, it doesn't hurt. It tickles if you feel anything. So we're gonna do both top and bottom lid. So you just hold this in about 15 seconds or so. If you ever have any itchy lids, any red eyelids, I would suggest you visit an eye care professional, an optometrist, for them to take a look. And you may be suffering from early signs of blepharitis and or Demodex, and it can be easily handled right in office. Okay, so we're gonna come in here and start with your eyes closed. I didn't realize how short I was. I'm gonna break it down a little bit. Okay. And we're gonna start the cleaning agent process here. Are you okay, Jimmy? What does it feel like?
Tickles.
It tickles? Okay. Yeah, that's what most people say, that it tickles. And so we'll start from the inner canthus and we'll work out temporally to the temporal canthus. And that's all doctor talk. But meaning we'll just start from the part of the lid closest to the eye, to the nose, and work out towards the eye, to the ear. And we're just going to be going in a circular motion.
Anybody ever accidentally open their eye?
No, but there's a part where your eye's going to be open, so it'll be good. And so typically we'll go forward and then you'll hold it down and it goes to the reverse mode. And as the hygienist, you don't need to do anything, but each mode feels different. How does this mode feel, Jimmy? Does it still tickle?
It's more of a massage.
So he said the reverse mode feels more like a massage. I'll put a little bit more. So nothing hurts. This is a really relaxing procedure. So far, most of our clients that have had this done have been men. Like I stated, men are less likely to clean around that area. Okay, this is the pulse mode. And so this is almost like flossing. How does this feel, Jimmy? This one feels weird, huh? Does it hurt?
No.
Yeah, most people don't know how to say how this mode feels. And this mode is the patented mode. This one makes this different from other cleansing agents out there. We have another device that we use here as well. But that's usually, we'll use that right before our MIBO treatment just to remove any scurf or debris. But this is usually a little bit more intense. So if I usually prescribe the AB Max for you, it's because you're well beyond that mild range of blepharitis. Yeah, so this pulse mode is the one that actually gets in between each lash. Okay, and so next one we're gonna have him look up. We're gonna do his bottom lid.
No, mild.
You can open your eye now. If you have any questions, you can just put it in the comments. All right, so I'm gonna do your bottom lid. This one's a little weird, but you're gonna look up. And so on the bottom lid, we get right along the base of the lid margin. So we're cleaning the lids, but we're also gonna reduce some of the biofilm. Then I'm gonna go back and do the top lid again because we just wanna get right on the inside, the part that's slimy. So women, you're not supposed to tight line, but if you do, you notice that your eyeliner slides and it's wet because that's biofilm, that's bacteria. So that's why you definitely don't want to put makeup on that area there. Still tickles? said it's weird. It doesn't hurt. It just tickles.
I just wonder how you keep from pulling my eye. It seems like I accidentally opened my eye.
You're fine. Your eye should be open. Yeah, we're not on the lid. And he had a good question. How can you stop from poking somebody in the eye? Well, the mechanism on the device will actually stop if you get off of the lid margin. Open your eye. So it's really hard to abrade the cornea. How does this feel?
I feel like you kind of scratching it. Not like a soft scratch. Is that pulsating?
Mm-hmm. So you survived. All right, lean towards me here a little bit. Come in a little bit. So his lid margin looks pretty good. Like I said, his eyes were pretty good. It was his meibomian glands that needed some work, and he had a low tear meniscus, or tear film. Tear meniscus, tear lake. So he should be taking his Restasis
Every day.
every day. So usually afterwards, there's no pain. You may have a little bit of redness, and if there is some redness afterwards, then usually we always put a drop of Lumify in the eye. So that way it just helps with some of the redness. So we're going to go do that now. Then I usually give them a sample of Lumify to take home. So that way if their eyes are red afterwards, they can. And like I said, some patients, depending on the severity of the lid disease, they may also leave with a topical antibiotic combination drop, so antibiotic and steroid. This is something that is painless. It doesn't hurt. Usually the ambiance is set where it's dim in here. We have a mister, we have music. So it's really a good experience to come in and have your lid margin clean. So we went over who we think is a candidate. So definitely anybody that wears makeup regularly is a candidate to have a lid microexfoliation. Anybody that wears contact lenses, anybody that is experiencing a red, itchy, irritated eye, you want to be evaluated to make sure you don't have an increase of biofilm, blepharitis, or Demodex on the eyelid margin. Or anybody who may have certain autoimmune conditions that increases their chances of lid issues. Anybody that suffers from rosacea. Usually rosacea has a lid disease component associated with it. Remember, we have two ways that you can get the lid microexfoliation here in our spa. The price starts at $99 to $139. The $139 is the bundle. So the bundle is going to give you the products that you need to go home and to continue the process for at least a month. So we're going to put our 1 drop of Lumify in for Jimmy here. So if you look up. There we go. Did that sting?
No.
No. So typically Lumify doesn't sting. And you're able to recap the Lumify. Of course, if I wasn't on live, it will recap. And then I'll give it to them to take it home to be able to continue the process. There are other doctors, there are other ways on the market to clean the eyelid. I like this. It is a small footprint. So this is what it houses on. This is the charging unit. Small footprint. This is where you can keep all your extra sterols. The disposables are totally affordable. So therefore you can pass those savings on to the patient. Small footprint and reasonable investment, but makes a big difference in the comfort of eyes for patients, both men and women. And also if your child, this can be done easily on a child. If your child is mature, I've had a lot of cases of kids where they've had blepharitis, irritated eyelids, or meibomian gland issues that we're able to do this process on. So that's it for today. I wanted to keep it really simple. I think I might mosey on to Instagram because I don't want to forget about my Instagram friends and Eye Squad on Instagram, so that way they can get a quick peek of the lid microexfoliation. This is not a procedure that's only for women or people who wear makeup. Like I said earlier, most of the cases that I diagnose with blepharitis or Demodex are men. The eyelid margin is an area that we don't clean as often as we should, and we know when that margin is not clean and maintained with good hygiene, as you age, it's going to increase your chances of ocular surface disease, okay? So once again, my name is Dr. Janelle.